Hello, this is Dr. Simpson. I got dental advice for you. Today I'm going to be talking about pain and infection in your mouth. They don't always coincide or occur together. You definitely can have a tooth infected. You can have a tooth have a decay or cavity, which is technically not infected. It's not infected, in my opinion, until the decay gets to the pulp or the nerve of the tooth, or you have gum disease. That's infection also. But infection, all infection does not hurt in the sense of you feeling pain. It does hurt as far as your being hurting you, even if it doesn't pain you. Does that make sense? So a lot of times patients have decay. I call that, the tooth is affected by decay. It's not infected by decay, because until the decay gets bad enough and goes to the middle of the tooth, where the nerve is, it's not infected. But once it gets to that nerve, it's infected. You need a root canal and get it pulled. You can't get a filling. But when you come to the dentist and we tell you, especially if you ain't been to the dentist in a while, you're not having no pain, we do x-rays of your tooth and we show you that you got a cavity, and the cavity or the decay on the x-ray is reaching your nerve, and we tell you it's infected, it needs a root canal and a crown or get it pulled. Well, of course, that don't mean you got to do it because it's your mouth, right? But if we say it's infected, and hopefully, I know I show my patients the infection on the x-ray, even though they're not dentists or dental professionals for the most part, I still educate them as to why it's infected. And when I show them that, they be like, wow, well, can you just do a filling, doc? No, I'm not going to put a filling inside your nerve. Not me. Maybe somebody else will. I won't. That nerve needs to be taken out, and then the area called the root canal will be filled. Okay, but that's called a root canal. That's not called a filling. So not to, to make it clear, because it can be confusing. Just because a tooth does not give you pain does not mean that it's not hurting you, affecting you, causing you harm. And at some point, if it's not giving you pain, it will. Swelling, pain, or both, or none. All right? So please understand when I say infections don't always hurt as far as pain-wise. Now, on the flip side, if a tooth is hurting you, that doesn't mean that it's infected. You could have a lot of different situations in the mouth that could be affecting your tooth, your gums, your other oral structures, but it's not infection. So don't think just because your tooth is hurting that it's infected. Now, if usually swelling accompanies that pain, most of the time it is infected, okay? But sometimes your teeth just hurt. They can be sensitive to hot and cold. That doesn't always mean infection, but it could mean affection. I guess not affection like I love you, but affection like something is affecting your tooth. Does that make sense? So that's where my affection for you as a patient comes in, to hopefully help you get rid of that pain sensitivity caused by that. Now, if it's infected, I'm going to tell you. And most time, if I tell somebody that's hurting in pain and swelling that their tooth is infected, most people have common sense and don't not believe me or question me, but you have every right. My patients question me. I want you to question me, because it's your mouth. You're not going to feel comfortable. Well, some people are not going to feel comfortable until they totally understand. And some people be like, all right, doc, whatever you say, let's do it. I have all types of patients. And then some patients want to know every little step, every little reason why the tooth hurts or whatever. I'm going to tell them as much as I can possibly tell them. And if they, want to know, to make them understand so they can make a better educated decision, I will do that. And most of us dentists will. Hopefully yours does. All right. So what did we learn today, boys and girls, men and women? Infection does or does not always hurt in pain. I'll wait. Okay. Now, does pain always mean that the tooth is infected? And the last question is, if it's infected, can you just do a fill and dot? Exactly. So hopefully you learned something today. If you have any questions, comment below. Go to my website, dentaladviceforyou.com. I'm Dr. Simpson. I love to talk to you. Put some suggestions in of any kind of videos that you would like to me to talk about or whatever. A lot of these videos is coming from y'all and questions that y'all been asking me, and that's what I'm here for, because I get a kick out of all this crap. Well, you know what I mean, crap in a good way, not crap in a bad way. All right, love y'all. Have a good day.